Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello, my name is Dr. Margaux Lojacono. I am a physical therapist and current president of the American Academy of Orthopedic Manual Physical Therapists Sports Special Interest Group. In this podcast episode, I will be speaking with Dr. Shanon Fronek. Dr. Fronek is a physical therapist and, at the time of this recording, works for the Seattle Mariners as a rehabilitation and return to play specialist. She has over 9 years of experience in orthopedics and sports medicine, including having previously worked for the 76ers and their G League affiliate. She has completed a sports physical therapy residency in Division I athletics. She is also fellowship trained in orthopedic manual physical therapy and holds certifications in various modalities such as dry needling, spinal and extremity manipulation, and instrument-assisted soft tissue mobilization. She is a board-certified clinical specialist in sports physical therapy, a certified strength and conditioning specialist, and maintains additional certification in basketball training process optimization, blood flow restriction training, and is a credentialed clinical instructor. Dr. Fronek, welcome to the program.
Hi, thanks so much for having me. I'm so excited to be doing this interview with you guys.
I'm excited too. So before we get started, can you explain a little bit about how the affiliate structure is set up and kind of where your physical therapy interventions occur within the team structure?
Yeah, so I think it might be helpful to give some background information on the affiliate structure within baseball because if I'm being 100% honest, I did not know how that really worked with the different levels before I was in it. You have different levels of affiliates. So low A, high A, double A, triple A, and then MLB, like your big league team. So you have all of the affiliates in your big league team, and then you have the training facility, where is like our hub where everyone goes for all the things during spring training and rehabs and those kind of things. And so once spring training is over, we all break and go to the affiliates, depending on where we're at. But my role within the organization is to provide long-term rehab services to our players in the off season at our spring training facility in Peoria, Arizona. And then during the regular season, I am with our affiliate at the AAA level, which is the Tacoma Rainiers in Washington. And so I will primarily help with daily maintenance, any short-term rehabs, and then players who are placed there on a rehab assignment. So what that often means is that if a player has a long-term injury, so something that might require them to be out or unavailable for a couple of weeks, they'll get sent to the training facility in Arizona where they'll do rehab. And then if they just need a little bit more time to develop their performance again, meaning they're available to play, but they still need to build back up a little bit more, then they'll get sent or placed on a rehab assignment. And sometimes that would be with me at the affiliate until they're good enough to go back to the big league team.
So anyone who's taken out of play for any reason goes to the hub in Arizona, or does it kind of depend?
It really depends. If it's someone that's going to be out for a week or two, maybe depending on what the injury is and what the needs are and those kind of things, then they'll just stay with the affiliate. But if it's something that requires a little bit more longer in duration, they'll go back to Arizona for rehab and work with the physical therapists that are based there.
That makes sense. And I'm assuming that you're not the only healthcare professional working with the athletes. So what other professionals do you work with?
Yeah, that's a good question. So at the affiliate, it was myself, an athletic trainer, and a strength conditioning coach. That was our medical performance team at the affiliate. And then when I'm back in Arizona, we have a whole rehab team that's based there, including myself. In total, that we have 4 rehab professionals at the complex in the off season. And then in the regular season, there's 3 people based there.
So it seems like there could be some overlap between yourself, the athletic trainer, and the strength and conditioning coach. What is your niche or what is your role in rehabbing the athletes versus the athletic trainer or the strength and conditioning coach?
That's a good question because I think it can vary depending on the organization and just how things are structured. I know, for example, my role within baseball this season was a little bit different than what it was when I was in basketball, even though my position was relatively similar, I would say. When I was at the affiliate, I would essentially help out with just daily maintenance with player care. So player comes in, they just need a little bit of soft tissue work, or, they're really sore, achy from pitching last night and threw over 100 pitches in a game. So I'll just help out with some of the manual therapy stuff and any kind of corrective things. Usually at the AAA level, players are pretty well established with their routines already, especially pitchers. Like every pitcher usually has some kind of arm care routine that they've already been developed. They're usually been involved with the organization long enough to where their routine's already established. So we don't have to do too much education when it comes to stuff like that, when it comes to arm care and things. But if I were to be at a lower affiliate level, then that would be something that we'd have to spend a little bit more time doing, is developing those routines. And then I'll help out with short-term rehabs or just some players that are dealing with nagging injuries. It's pretty uncommon, I think, at this level for players to not have something going on that they're working through on a daily basis. That's just kind of the nature of pro sports, really. So I would say in that regard, I would have a lot more overlap with our athletic trainer in terms of our day-to-day responsibilities, but he would be the one doing all the on-field stuff. So if something happens during a game, he would be the one to go out on the field. Whereas during the game, once our pitchers came out, we do arm care with them. So I go leave the dugout, go in the clubhouse with them, and we'll do some arm care stuff or recovery modality type of things. On the S&C side, there's probably just a lot more collaboration that takes place. The roles are a little bit more clear, I think, when it comes to that, because I'm not really in the weight room a ton during this season. It's just more of, hey, what are you seeing? What am I seeing? And just that daily communication, and also just providing some guidance in the event of a short-term injury, activity restrictions, or things like that.
And so how is that different from during the off season when you're at the hub?
When I'm in Arizona working at our complex, I am strictly rehab. So I will be doing long-term rehab just as you would in a clinic. So that's probably where it's similar to more of a clinic environment. And your patients come in the clinic, you treat them, and it kind of works like that though every day, which is different than a clinic. So the players will come in 5 days a week, usually in the off season, 6 days a week during the regular season, and we do rehab every day. And again, with that, it's a lot more collaborative with the strength conditioning coaches. So we have rehab reconditioning coaches that work specifically on the strength side. And so we'll collaborate with them again about activity restrictions, return to sport progressions, and those kind of stuff. On that side, it's still much more of a collaborative environment because the players that are there aren't there because they're playing in a game. So we don't really have a ton of overlap with the athletic trainers on that side, if that makes sense.
Did you always know that you wanted to work with athletes?
Yes and no. It's kind of crazy because, I played sports growing up all throughout high school, and I originally went to college to play basketball and major in athletic training, and then neither of those things ended up happening. And so it kind of took me a while to figure out the route that I wanted to go in terms of even just wanting to be a physical therapist, and then figuring out eventually during my final clinical rotation when it was more of a sports medicine type of a setting that I wanted to pursue sports and have that be my career path.
So how did you transition into professional sports? What was kind of the path that you took after graduation?
Since I didn't realize I wanted to work in athletics until my final clinical rotation, I knew that I was going to need to spend some time building up my resume. So I spent 2 years working in just general outpatient orthopedics, taking advantage of various volunteer opportunities. networking, getting involved with a sports academy and those kind of things. And eventually, after a couple years of sports residency applications and rounds, I did the Division I sports residency at St. Francis University. Once I was done with that, I didn't really know what I didn't know at that time when it comes to like what it takes sometimes to get to that next step. And so I was a little bit ignorant and decided that I was like, if I'm not working in sports, like I don't want to go back to working in a clinic or like commit myself to working long term at a clinic because I know like where I'm trying to go next. So I ended up doing travel physical therapy for a couple of years. And during that time, I again was just taking advantage of other volunteer opportunities like at the Olympic Training Facility. And that's when I started doing my fellowship training in orthopedic manual physical therapy. Because for me, I saw that being a way to differentiate myself and also just a skill set that I was going to enjoy and see that I could make a difference in that like capacity at that level. Then I finally got my first break in pro sports with the Philadelphia 76ers and working with their G League affiliate. And unfortunately, with the pandemic, that didn't last as long as I would have liked. After that, I just kind of took some time off. It was a grind and it was so much fun. I loved it. I love basketball too. It's one of my favorite sports. I mean, I played it growing up. And it just took a lot longer to get my foot back in the door for me. I've always enjoyed from the clinical side, just working with overhead athletes, but then from just like a passion and hobbies, I just love basketball too. So for me, it's always been baseball or basketball usually. It might be a little surprising to know that I've probably interviewed with, I don't know, at least over 10, maybe 15 organizations, and I've only had 2 jobs in pro sports. It's taken a lot, and it really just is a matter of timing and fit and patience and persistence. And finally, this is my first season with the Mariners and this organization, and I'm very happy to be back in this environment, and especially too in a different sport because it's given me like a lot of unique perspective, and I've really enjoyed this season. And the cool thing about baseball too is you get to see a lot of diversity with the injuries. I mean, you get finger, hand, wrist, like forearm. It's a lot of oblique stuff, rib stuff, things that you just don't normally see in other settings, I feel like. I've really enjoyed that piece of it a lot from a clinical perspective, I would say. So yeah, that's where I'm at now.
I think that's really interesting that the route that you took, because I feel like a lot of new grads and early professionals feel like they have to have their perfect job right out of school or shortly out of school. And I think it's good to show and learn about therapists who have taken different routes to get where they are, to show that like each job that you have or each experience that you have just helps to contribute to your skill set and help you move and grow.
Yeah, definitely. I want to comment on that real quick. I think it's good advice based on like what you just said to make the most of every opportunity in every position. There's been, especially during the pandemic and doing travel PT again, and after having just worked in pro sport, I really kind of had this mental struggle initially with where I was at in comparison to where I was at before, and not being where I was at in my career and not being like happy with where I was, and kind of switching that mindset and at least positioning yourself, even if it's not exactly where you want to be, in a position to where you can still grow. For example, taking a clinic director position before I was in baseball, just because I wanted to start working on my leadership skills. There's always something that you can grow and gain from any position because everything is so different. And so it's like, just because you're not exactly where you want to be, or you're not able to necessarily like grow your skills working with pro athletes, there's still those soft skills and there's other clinical skills, leadership skills. There's lots of different things that you can take from any position that you're in. So just take where you're at and appreciate it and gain what you can from wherever you're at.
For someone who is interested in working with professional athletes and getting to that next level, what advice do you have for them? I think you kind of touched on it as far as growing skills, but is there anything in particular, education wise, certification wise, kind of things like that, that would be helpful for someone who's looking to work with athletes of any level, but more specifically higher level athletes?
Yeah, I would say first and foremost, find a path that works for you. It's your career, it's your life. Working in sports is an absolute grind. And It's something that you don't appreciate until you're in it. So you want to be happy with your own career trajectory and the path that you kind of put yourself on. So again, for me, like that was doing a fellowship program and differentiating myself with the manual therapy courses that I had taken. So I would say first and foremost to just create your own path and stick with that, because do what makes you happy. And then it's going to depend based on the organization. It's going to depend on the sport. Some organizations in baseball are very PRI heavy and functional movement screen heavy. So it honestly just depends on the organization and the sport that you're in. But what you want to keep in mind also is that it's not about who you know, it's who knows you. You can network and try to get to know as many people as you want, but if you're not putting in the work to show other people that you have the skills, you have the knowledge, you personality wise are capable of fitting into that kind of environment also, because that's a big thing when you're working with players and staff every day, all day long. Like you kind of have to know how to navigate certain situations. And then I think the other piece is just to stay patient and persistent. I know for me, when I was in that like 3-year period, that 3-year window when I wasn't in sports and trying to get back in, I almost left the profession entirely because I honestly thought, I'm like, maybe this is just isn't working for me. Maybe I'm just done. Maybe I did my time and that's the end. But you have to keep in mind too that it really is just a matter of timing and fit. When I got the positions with the Mariners and when I had the position with the Sixers, those interviews were the most smoothest interviews I've ever had in my entire career. Our philosophies just aligned. And so it's similar advice that I give to people when they apply to residency and fellowship programs. It's just find what works for you and what's going to enable you to be the practitioner you want to be. If you're not into PRI, probably don't want to go and work for an organization that only does PRI. Honestly, it's just more about putting in the work than anything else and like going after what you want and staying persistent about it. I would say, though, having a really strong foundation in strength and conditioning is very important if you want to work in sports. You need to be able to speak the language. You need to be able to have those conversations with your coaches. And if you don't know what they're talking about, that makes for really difficult and challenging conversations and for good athlete care, in my personal opinion. I would say that is one area of knowledge to acquire. It would probably be that for sure.
It totally makes sense. Let's change gears a little bit and let's
Yeah.
talk actual physical therapy. So, you
Okay.
mentioned earlier in the interview, and you also mentioned when we spoke earlier, that you do use a lot of manual therapy. Yay, OMPT. So, are there specific techniques that you like to use, or is there like you have a couple go to kind of things that you like, or does it really depend on the patient?
Yeah, I kind of use my entire toolbox, honestly. I've taken courses in spinal and extremity manipulation, scraping, cupping, mulligan. My PT background was very heavy in osteopathic manual physical therapy from my DPT school days. So I utilize kind of a little bit of everything depending on the person, the timing. And I think also too, like having good feel in that environment is important too, because if a player is not down with dry needling, don't be trying to stick a needle in them. They're probably not gonna like come back to you, or you're like you're buying like their buy-ins are really bad. So yeah, it kind of just depends on the person and the scenarios. Another example when it comes to dry needling, I would say, is if you have a pitcher who's starting that day and they come into you for like upper trap tightness, I'm probably not going to be needling them if it's their first time or if they have like a pretty profound soreness response from it, just because that's going to affect their performance. So you just have to be really in tune with the player, the environment, people's response to things. And I mean, when you're with those guys every day, you learn that stuff anyway. So it really helps with that decision-making process, but that's where the art of the science comes into play, I would say. But I did really find needling to be particularly effective in that environment, as well as the manipulation techniques. And I utilize manual therapy every day with those guys. That was not my role, but that's kind of what it evolved into being, essentially, just doing a lot more of the recovery stuff, anything that helps with daily maintenance, just to make them feel better when they're out there playing the game.
So how long does your treatment session last with the athletes?
Usually not very long when it comes to the manual therapy stuff, because it's usually 5 to 30 minutes depending on needs. But you have so many players that are cycling into the training room throughout the day that you don't necessarily like have that time. So again, that's where the art of the science comes into play. How can I get the most bang for my buck? What is the most effective and efficient intervention strategy that I can use to get the best result that's going to make them feeling the best, the fastest, and what they can tolerate and what they're comfortable with on top of that. It's not just about me, it's about them, obviously. So a lot of those factors come into play with some of that decision making, I would say.
Can you talk a little bit about how your schedule is on game days versus non-game days?
Yeah, so that's a good question because we actually would play 6 days a week. So we would play Tuesday through Sunday. Then our off day was Monday. So it would either end up being a travel day or a genuine off day. My schedule was the same every day when it came to working with the players in baseball, but it was a little bit different when I was in basketball because you don't play every day.
When you were with the basketball team, did you work with them before their practice, after their practice? Were you there during practice? Kind of how did that go?
It really depends. I mean, I might see someone before they go out to the game and after the game. If it's a pitcher, for example, they have times that they go out and do their dynamic stretch and throw for the day to kind of get warmed up. And then they kind of have another down period before the game. So sometimes we'll do some treatment before they go out to throw, and then maybe even sometimes after they throw, and then maybe even sometimes after the game. Usually that's like an instance where someone's really trying to like work through stuff and you're just trying to keep them available if you're seeing someone like that frequently throughout the day. And then the rest of it is just kind of more or less of what works for them. So some guys don't like to get work done before they go out to throw. So they'll wait until after they throw and then come in and ask for some stuff. Or some of them prefer to wait until after the game. Especially in baseball, a big difference between basketball is with baseball players, you have certain position players who are utility that can be in any position during any day. And you just don't know where they're going to be sometimes. So it's hard to predict workload, how you're going to manage their like daily care until you know like what position they're playing for that day. And then same thing too with relievers, because not necessarily in AAA. And again, like our organization might do things a little bit differently. So don't take what I'm saying like based on like this is how it is, because I don't know that for a fact. So, but with relievers, like they may throw back to back days. And so you have to keep that in mind with when you're structuring some of their treatment plans or their treatment programming. Try to do it a couple days before, or if you know that they're going to throw later that night, then you're going to wait until after the night or do it the next day if they're going to be down that following day. So it really just depends on the player and their position and how they're being utilized and what they respond best to. So there's a lot of moving pieces and parts that you have to kind of consider when it comes to, again, some of those decisions. And then sometimes it doesn't really matter. Like sometimes it's just general maintenance stuff. So it doesn't really matter when you do it.
Yeah, I guess I didn't think about that, about how not so much what positions the players play, but what position they're playing on a certain day or whether they're playing or not. I think that's really interesting for the listeners to learn about. Did you find a difference when you were working with the Division 1 athletes versus the professional athletes as far as the types of injuries that you saw or the severity of injuries that you saw?
I guess yes, because when you're at an affiliate where I was this past season, you're not going to see the long term injuries. It's going to just be daily maintenance and short term rehab if it's not sent back to Arizona. And then when I was in Division 1 athletics, it resembled more of the clinic environment, just the day-to-day flow. Like our clinic was separate from the athletic training facility and the weight room and all of those kind of things. So it was probably a little bit more systematic in terms of, okay, you get injured, so now you're starting with PT. Then we're going to transition you back to working with strength conditioning and the athletic trainers, and then it kind of being like a little bit more hybrid. I got a lot more exposure to long-term injury management in Division I athletics, as well as while I'm working at the complex in the off season, because I'll see nothing but long-term injuries at the complex in the off season, but I won't see those during the regular season.
When you were with the Sixers G League, was that setup similar to the affiliate setup that you were with this past season?
No, it was a little different. So with basketball, if a player has a long-term injury, let's just say a high-grade hamstring injury where they're going to be out for at least a month. In the beginning stages, we wouldn't travel with the team because we had better access to facility as opposed to like when we're on the road. So I would just stay back with the player. We would do rehab, any kind of on-court stuff that we were allowed to do. And then once that player was at a certain point, we would get back to traveling and being around that team environment. We didn't send the player anywhere. I would just stay with them. So I would see long-term, short-term, do daily maintenance type of stuff when I was in basketball, which was nice. The environment is so different between basketball and baseball. Like I feel like that would be a little bit more challenging to do that when you're at an affiliate, to have someone stay there. It does kind of make sense to me. I haven't seen it done a different way, so I can't speak on what that looks like, but it does make sense just based on how things operate on a daily basis at an affiliate to send a longer term rehab to Arizona, just so that they do get better player care, essentially.
And are most of the baseball organizations set up the same way?
No, actually, majority of organizations do not have a PT at an affiliate. So my position was very unique in that way. Most PTs will just only do long-term rehabs at their main training facility in baseball, unless you're with a big league team, in which case it will depend on the organization, because some organizations at the major league level will have one PT, multiple PTs. Some of them travel with the team, some of them stay back for player care or for injuries. Some of them have it to where they'll have a PT at the complex and then will fly out with players if they're on an assignment, a rehab assignment for a period of time. So it really does vary by the organization in terms of how that PT role is structured.
That's really interesting.
Yeah.
I didn't think about that. I guess I thought that it would be pretty much similar structure for all the different organizations.
Yeah. I mean, I don't mind it because I think it's pretty cool that the organization has a PT at an affiliate. And obviously, I would love to see that happen across the board. But I mean, I do feel very grateful because I do have a very unique perspective on things, especially being a female. It's not like I grew up in baseball. I played softball and fast pitch growing up. But until I was at the affiliate, I don't know that I would be able to understand things from the lens that I'm able to now if I had come into baseball and had only been at the complex. Because there's a lot of stuff that happens on a daily basis, politics and just honestly too being able to understand like the daily demands of these guys and what they go through, not just physically but mentally. And I think just the picking up on some of those small details sometimes can really help make a difference in your rehab planning sometimes. So I think whenever I do have the opportunity to go back to Arizona at the complex and start those long-term rehab plans up again, I think when we get closer to those later stages of them going back to the affiliate, I'll have a unique perspective on things. So I'm very grateful that I've had that opportunity. And I kind of do wish, that would happen across the board.
Oh, sure, because you're seeing them during the day while they're practicing and while they're doing their activity versus them telling you about it. And I think really with any patient, if you can see or watch or have them demonstrate versus just them explaining, you get a better understanding of what their experience is and what they're going through.
100%. That's so true. That's a good point.
So I have one more question for you, rehab related. I think everyone would understand that the level of pressure or maybe need to rehab athletes faster at the professional level versus high school or college. But apart from that, are there any differences or perspective that's different dealing with the professional athletes versus a non-professional athlete for something like, like a rotator cuff tendinopathy, something like that?
Yeah. If we talk about even just when we first meet with our patients in the clinic environment and we're doing our initial examination, and the question should always come up like, what are your goals? What are you trying to get back to? And kind of reverse engineering that process. When you're making that rehab plan, it's still the same, no matter like what level you're at. It's just that there's a lot more involved, I would say, when you're working with pro athletes. There's a lot more to consider. There's not necessarily like more on the line, but it is a business, and that's how they make money. That's how organizations make money. And so there is, I would say, greater pressure to get people back faster. You do have to understand some of those complexities that come with working in that kind of environment and some of the details that go into some of the decisions that are made. Sometimes you're not getting someone back to 100%. Actually, I would say like majority of the time, no one's 100%. Everyone's playing through stuff. Everyone's working through stuff. So it's a little bit different, I would say, in that sense. It's kind of just more of what is that minimum capacity that we need to get to in order to make you available again sometimes, and then continue to work on the rest of it from there. So that might be a little bit different, I would say, than like, working with a general patient population.
Yeah, it sounds like the expectation is different. So in the clinic, the expectation is that the patient will return to 100% before they're discharged. But it sounds like in the professional realm, in your experience, that your threshold is lower to consider it being successful. And then you're just continuing to work on things after they are cleared to play.
Yeah, definitely. Definitely. And I think also too, there's just a lot more analytics that go into working in professional sports that you don't necessarily need to consider when you are working with general population, or even potentially, depending on what level or school you're at, if you're working in college sports. Something that most people will probably understand is just like workload management. So when you're getting like daily reports back about players' workload on the court when they're running, and, all of a sudden they have like a tendon flare up or something like that. And so you're able to look back at some of that data and kind of assess if it's like truly like a workload issue or if it might be something else going on. So you have a lot more information available to you to help also with some of that decision-making process, which is nice, I would say. In some regards, it makes things a little bit easier because you have something else to go off of to help guide some of that decision making, which is nice. So I personally like having access to those resources.
Yeah, for sure. I think more information is usually better, especially when you're trying to figure out mechanism of injury or symptom response, right, to either their work or intervention. So that's really interesting that you have access to that information. It's pretty cool.
Yeah, I like it. I'm glad I have it.
Yeah. Well, that about wraps it up. I would just like to say, Shanon, thank you so much for joining me today. It was really a great time. I had a really nice time talking with you and learning more about the world of baseball and the physical therapist role in it. Thank you very much.
You're welcome. I mean, I appreciate the opportunity to come on here and just share my experiences and journey with everyone. And I hope that it can be helpful and impactful in some way. And if anyone ever has any questions, feel free to reach out to me. I'm happy to give any advice or just talk shop with anyone about anything. So feel free to reach out, and thanks so much for having me.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at AAOMPT.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AAOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AAOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.